Chapter 24, Benign Conditions of the Skin, from the Lewis textbooks, a review from class. Acanthosis nigricans is a skin condition characterized by areas of dark, velvety discoloration in body folds and creases. The affected skin can become thickened, and most often it affects the armpits, groin, and neck. The skin changes typically occur in people who are obese or have diabetes. Acne vulgaris is characterized by inflammation of the entire sebaceous unit. It often presents at puberty and persists throughout adolescence and into early adulthood. Males are more likely to have severe cystic acne than females. When females flare with menstruation during their 20s, they often have fewer comedones and more chin acne than males. The medical management is benzoyl peroxide and is indicated as a first-line approach for comedones. Another one is tretinoin, also known as Retin-A, and may be indicated in combination with the benzoyl peroxide in severe cases. Topical antibiotics would be indicated for inflammatory cysts like erythromycin or clindamycin are often used. Systemic antibiotics like tetracycline and erythromycin sometimes are indicated for difficult cases. Isotretinoin, also known as Accutane, is indicated in severe acne and has been shown to lead an improvement in greater than 90% of cases. It is a teratogenetic potential is high, and patients must agree to a pregnancy test before and during use. Because it is teratogenic, contraception is required for women who are using this medication. It's important for the nurse to determine whether a patient is using other birth control methods. This medication can also lead to elevated cholesterol, triglycerides, and an increase in liver functions test. It may also be associated with depression, muscle and joint pain, and dry skin. Patients who take Accutane, or the isotretinoin, must be closely monitored. Psoriasis is a common skin disease that affects the life cycle of the skin cells. It causes the cells to build up rapidly on the surface of the skin, forming very thick, silvery scales and itchy, dry, red patches that are sometimes painful. It is a persistent, long-lasting chronic disease, and the patient may have periods where the psoriasis symptoms improve or go into remission, alternating with times of exacerbation. For some people, psoriasis is just a nuisance. For others, it's disabling, especially when associated with arthritis. There is no cure, but treatments may offer significant relief. Lifestyle measures such as non-prescription cortisone cream and exposing the skin to small amounts of natural sunlight can improve the psoriasis symptoms. Psoriasis can occur on any part of the body and is associated with other serious health conditions like diabetes, heart disease, and depression. The signs and symptoms would be red patches of skin covering with the silvery scales, small scaling spots, which you would commonly see in children, dry, cracked skin that may bleed, itching, burning, or soreness, thick, pitted, or ridged nails, and swollen and stiff joints. Medical management is topical steroids plus cherolytic agents, and that's the first-line therapy for mild to moderate disease. Second line of therapy would be the ultraviolet therapy light. Now, the eye should be shielded from any UV light during the ultraviolet light therapy to prevent the development of cataracts, and the patient should be taught about the effects of the UV light on unaffected skin. New line agents like TNF-alpha inhibitors have been proven to be effective in severe arthritic psoriasis. Methotrexate is used only in severe cases. Retinoids are especially effective in pustular forms of the disease. Nonsteroidals are indicated for treatment of psoriatic arthritis and may add methotrexate if severe. Seborrheic keratosis are common skin growths. These are benign, non-cancerous growths and occur almost anywhere on the skin. Some people get just one, others develop many. Having many seborrheic keratosis is common and usually begins as a small rough bump and tend to eventually thicken and develop into a warty surface. The lesions, which are benign, are tan or black in color and do not require treatment, but they do resemble melanomas, so it is important to get them checked. Skin tags are called cutaneous tags and are common skin growths. They usually occur after midlife and are usually harmless and non-cancerous. The tag sticks out of the skin and may have a short, narrow stalk connecting it to the surface of the skin. Cutaneous tags are usually painless and do not change. They may be irritated by being rubbed by clothing or other materials, and the tags are more common in people who are overweight or who have diabetes. They are thought to occur from skin rubbing skin, so they commonly form in the skin folds. Montego is a small pigmented spot on the skin with a clearly defined edge surrounded by normal appearing skin. This is a harmless, benign hyperplasia of melanocytes which is linear in its spread. This is caused by sun damage, including sunburn and indoor tanning. Most of the time, these are just left alone. Other approaches would include sunscreen, vitamin C, maybe a chemical peel, cryotherapy, and maybe a pigment laser.